I asked why the government is taking so long to respond to the Senate inquiry into universal access to reproductive health care. That inquiry was produced a consensus report with 36 recommendations that every political party that was involved and in this chamber agreed upon, and still it's 10 months later and we haven't heard boo from the government. And I asked the minister, well, when? When are we going to get a response? When are the women of this country who are desperate to have affordable and timely access to reproductive health care, whether that's terminations, whether that's maternity care, whether it's everything in between, when can they expect a response? And I'm so disappointed that I didn't get a time frame. The minister says there will be one. Great, there has to be. That's what is required. But it was meant to be 7 months ago. You're meant to take 3 months to respond, not 10, and then still say you're under consideration. I mean, they were great and meaty recommendations, but surely with entire departments and a minister who I know is committed to this area, dedicated to this, what is taking so long? And I didn't get a response from the minister on why the delay, and I know that so many women and experts that work in this area will be really disappointed that there seems to be continuing delay and yet no action and no explanation for it. Now, I note that in the Women's Health Summit last Thursday, many of the expert presenters who spoke so eloquently and who articulated the problems in access to healthcare and reproductive healthcare in particular, many of those experts endorsed these recommendations. They want them to happen, and women deserve affordable, accessible reproductive health care. I also asked the government, all right, if you won't tell us when you're going to respond, can you at least give a commitment that you will implement these recommendations, these consensus recommendations that were not as strong as the Greens would have liked in all respects, but which would genuinely improve access to health care that we all pay Medicare and taxes for, that we all deserve as part of citizens in a wealthy nation. And again, the minister did not give the commitment that the 36 recommendations of this consensus report would be acted upon. There are still so many barriers, whether they're financial, whether they're physical, geographical, in accessing abortion and contraception and sexual health care and maternity services right across the country. We know the problem is even worse in rural and regional areas. We know there are workforce shortage issues that are even further compounding this problem. This issue is urgent. We need a response. And in particular on terminations, given that the Labor Party has ruled out returning to their 2019 policy, which said that if you're a hospital getting public funding, you need to provide the full range of reproductive health services. Given they have resiled from that formerly strong and good position, then we really do need action on that recommendation that says that you will fund alternative pathways so people can get accessible terminations when they want one. There's been no action on changing those funding arrangements with private hospitals, and women are still not able to get terminations when they need it. We hear stories of women having to travel hundreds of kilometres, assuming they can even afford the travel costs, to get a termination for an unwanted pregnancy. It is absolutely unbelievable in 2024 that pregnant people are still facing that level of inaccessibility to basic health care. It needs to be fixed immediately. We also heard that there are newer birth control pills, newer contraceptives that don't have as many side effects as the old ones that are on the PBS, but these newer ones that are better, they're not on the PBS, and so you've got to have squillions of money to be able to afford them. Most people can't. And that's even when they're available. Sometimes we have supply issues and import issues. So again, there needs to be action on that. And the committee recommended that we look at expanding the scope of practice for midwives to include, for example, the insertion of LARCs, long-acting reversible contraceptives. That should be on the agenda for a minister that has a strong background in these areas. There was also a recommendation that the midwife reforms proposed in the MBS review finally be dusted off and implemented. And again, it's been, 6 years now for those decent recommendations. They should be acted upon rather than just continuing to be ignored. The government is making women wait for a response to this inquiry, and women deserve better. They're making you wait for super on PPL, they're making you wait for longer PPL, they're making you wait for universal access to reproductive health care. Why are women having to wait when a whole lot of other budget priorities aren't asked to wait?
Authorised by L. Waters, Australian Greens, Canberra.